This week's Ask Dr. Durie comes from a patient who asks a very common question, actually, which is, how important is it for a myeloma patient to see a true myeloma specialist versus a regular hematologist oncologist who is seeing and dealing with all types of cancer? The answer to this question is a definitive yes. If at all feasible, it is really helpful for a myeloma patient to see someone specialized in the disease. And obviously I realize that this may not always be easily feasible for a patient to travel to a large center to see a specialist, but there can be phone consultations arranged, and patients can also come to IMF patient seminars or community workshops to get in touch with true myeloma experts who can really help guide care. The key thing about myeloma is that it is a very different disease. It has many special features involving special testing, and also in the last several years quite a number of novel therapies have become available which do require specialized knowledge to administer in the best possible way to achieve the best results for a patient with myeloma. And so getting that input from a myeloma specialist is particularly important. This kind of input is especially important at the time of initial diagnosis, when one first needs to be sure, is the diagnosis of myeloma correct? This is obviously a key first step. And assuming that the testing has been done correctly, it's important to make sure that all of the complete baseline testing that is helpful to assess the prognosis and the risk, etc., have been done in the proper way. And then coming up with the correct initial treatment plan to set the stage for a good initial therapy and the best response possible. This is really very, very important at the outset of diagnosis and initial therapy. Now, along the way, it can also be important to get input, but mostly the day-to-day monitoring and treatment can be administered by the local doctor. However, if there is at some point a question about relapse and a need for new treatments, this again can be a point where specialized consultation can be arranged and should be, if feasible, to get the best input about the use of the many new drugs that are becoming available. And so the bottom line in this case is pretty clear. If feasible, it really is important to get a specialized myeloma expert input, either by direct consultation, by phone call, or attending seminars or meetings. And this is the mantra of the International Myeloma Foundation, in fact, that knowledge is power, and getting that knowledge from a myeloma specialist, and also the patient or family members getting that knowledge and being empowered to know about the disease and seek the best therapy is a key aspect of achieving best care and the best chance for the best outcome.